Good morning, Dr. Lebo Gyno. Today we have a 38-year-old from Connecticut with gynecomastia. Now, he originally just wanted me to do the right side. It's kind of nice and big, and it bothers him. It hurts him a little bit, it's movable. It's free. I'm not worried about it, but we're going to get it out. Local anesthesia, stealth incision, where the water meets the beach. I don't believe we need drains, but you never know until you get in there, but I really don't think we need one. Speaking about gyno, he originally said he doesn't want this side, but when he came here, he was like grabbing this one and squeezing it and worried that's going to come in, get bigger. So we're going to do this side too. And again, he's got gland in there. It's definitely gland. I can feel it. I can pinch it, and you'll see it come out. He said, "What the heck? I'm here. Let's just do it. We're not burning any bridge if we only do this side." But he's here, and he said, "Just do it, so we don't have to worry or think about this, because my results are guaranteed. Never a recurrence. If anything does recur, or scar tissue, or whatever, it's all included in this original surgery." So again, local anesthesia, stealth incision where the water meets the beach, get out these bilateral glands that we're doing now. This right side is bigger than the left side, and everything is perfect. So Lebo Gyno, 631-424-0101, or email me at jonathanlebowsmd@gmail.com. Let's go. No. Yeah, so that's the midline, that's the median, this is the pec muscle here, and this is really where the gland is, or the extent of my local will be. Perfect. Good. Don't move.
Let's begin by introducing ourselves. I am Han of Dance France, and we want to pump you up.
Alright, so he's all numbed up. We let him sit for about 20 minutes. That's the secret of local. You gotta let it numb and take effect. It's got Novocaine and Epi in it. A little bicarb to change the pH. So, let me arm down just a little bit so I can make sure that the incision's anatomical. I can see where the areola is. You don't want to cut into the areola or into the skin. You want to hide it. Right here. This is the bigger side. This is the big boy. Right. Done bigger though. See the gland peeking out right there. Up the arm just good. Now again, I can see the thickness that I want the nipple to be. Undermine this. So I know exactly how thick I want everything. And we're also going to flip the nip to make sure it's perfect. I do guarantee my results, so whatever comes back, it's on me, not on anybody else. There. Continue here. This way a little bit. Nice. Okay. So once that's done, I can feel it right there. Clean it up a little bit. So what I'm doing now So I want to get the gland out, you know, perfectly. So any little yellow fat, I'm gonna kind of get out around it. Which one's here? Make sure it's all freed up. So next, once that's done, grab the gland itself. Start to have my own special technique of kind of scraping the fat out. And just chase the sucker on the sides and bottom. And the tail. And just find where it kind of turns the corner. Right there. Getting that nice plane. Once I make that plane, I can also do a little it's a towel clip. But that's basically what it is. Once I'm in there, I can kind of feel I can get in there. You all right?
Oh yeah.
Feels funny, huh?
It's an odd feeling. That's
Yeah.
for sure.
And I can scrape the muscle away from it. And I can feel the tail of it right there. Gotta do a little bit more work on that. But when that's done,
All good. Oh yeah. Nice.
I can start to go into the head of it a little freer. Around it. So the juice. Good. And I can feel these scissors are kind of an extension of my fingers in my mind. So I can feel what is gland and what's fat. So now I'm just searching for it around the tail as it heads into the armpit, into the lats in the back. Get there. Feel again. Nice. I can feel a nice lump of it here. Into the armpit. Free that up. Good. What else? Put this in there. Alright. Start to release it gently. Have patience. Glands should be like children. Once you had enough of them, kick them out of your house. That's what we're doing.
Mine would be out a long time ago.
Kick them out of your house. Once they start giving you shit.
You getting this right? Oh yeah.
The Lebo philosophy of life.
Yeah, that's right.
It gauzy out of there. But so far so good. Still need free it up from the bottom. There you go.
Doing great.
Good. Now again, I can see as I push it where it's still stuck. See right there? It's still stuck. So get in there and just free it. Good. Top of it now, without button holding the skin. There you go. I don't know, I'm feeling the drain. Let's see, need a little more local. Alrighty, almost there. Almost evicted. There you go. Eviction completed.
Nice.
So that's your glands.
Take one. That's a chicken.
It's a piece of chicken cover. Let's free this up a little bit. You'll be surprised at the size of this one. Yeah.
So small.
No, you'll be surprised. Doggy. Head clamp. Alright, so we're freeing it up on top. Oh yeah. Oh yeah. What do you think it's going to be? Big? Small? Half the size of the other one? Quarter the size? What do you think? A Whopper Junior? I haven't had a Whopper in a long time. Come on, we'll get one.
Go to all American.
No, I like a Whopper. They're so good. All American? Where's All American?
It's like Master Pizza, I think.
Yeah.
Or Ocean Size. It's one of those.
Massive people.
All American?
Right, all American.
Really?
Inexpensive too.
They're expensive.
No, it's inexpensive.
Oh, inexpensive.
Inexpensive as compared to McDonald's and what you get.
see the sucker.
Oh, good, my friend.
So now I'm under it, and I'm on top of it, freeing it up. Here we go. White boy grows on my hair. No, not purpose.
From Connecticut?
No, Missouri, Kansas City, Pennsylvania.
Okay.
Missouri?
Pretty big out there then.
Yeah.
Yeah. Yeah, from Kentucky.
I've been there, but I've never lived there.
I've been in Ohio for 11 years. I love Ohio.
I lived in Dayton for a year.
You live in Dayton?
Yeah.
I live in Cleveland. I love my Cleveland. Gets a bad rap, but Cleveland it's a nice city. When I first lived there in the 70s, they had all these wig shops. I go, what are these wig shops? What?
A wig shop.
The wig shops.
Yeah, man.
All right. Are you ready?
Sure.
Should we have a drum roll here? Are you ready to see the sucker? Here. Look.
Look at that thought.
Smart.
Yeah.
We did. Dr. Lebo Gyno, finishing up beautiful case, bilateral gynecomastia gland removal, the right side being much bigger, not much bigger, about half the size of the left. He originally wanted only the right side, but when he came in here, we were talking, he says, just do the left side also. So we did bilateral. He's 38 from Connecticut, and staying here for a night or two rather than driving up. We're supposed to get a storm tonight. So I see patients 24 and 48 hours post-operatively. The glands were big, so we had to put in drains. If I put a drain on one side, I might as well do it on the other side. Keep things symmetrical and even. So I close them, and it heals identical, so there's no mismatch on the sides. And I do guarantee my results. These are the glands that we got out. Again, this right side was pretty much twice the size of the left side. But the left side that we were not going to do was pretty substantial, and he was concerned that this is going to rear its evil head, in the future. So he said, Doc, I'm here, just do it. I'm going to see him 24 and 48 hours post-op. Drains were exited out of the armpits, stealth incisions, and all self-absorbing stitches in the nipple. The drains will stay in about a week. So all that said, if you have gyno and you're from Connecticut or Cucamonga, there is Cucamonga, California. You call me Dr. Lebo, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Thanks, and see you soon. Let's go.